Good afternoon, everyone. I welcome you all on behalf of State National Homeopathic Medical College and Hospital to our series of webinars on miasmatic diagnosis and its clinical application, organized by Professor Dr. Amit Nayak sir and Professor Dr. V.P. Verma sir, HOD of Organon of Medicine. On behalf of State National Homeopathic Medical College and Hospital. My name is Vaishali and I will be your host for today's program. Today we have Dr. Ashok Kumar Das sir as a speaker who is gem of Indian homeopathy, who has done MSc, MD homeopathy, PhD from Calcutta University, gold medalist. He is former professor, National Institute of Homeopathic Kolkata, who fellow on Cancer National Institute of Health, USA. Former member, Drug Proving Committee, CCRH, Government of India. Former member, West Bengal, Council of Homeopathy Medicine, Government of West Bengal. Former Director Pharmacy Courses of West Bengal. Council of Homeopathic Medicine, Government of West Bengal. Chairman Scientific Committee, Homeopathic Medical. He has written so many books and the most important is a treatise of Organon of Medicine, Volume 1 to 3, and Fundamental Homeopathy Reparative Concepts, Method, and Techniques. Understanding Hahnemann chronic disease, their peculiar nature, and their homeopathic cure. So, this is all about our speaker, Professor Dr. Ashok Kumar Das sir. Now, I request our principal sir to say few words about Dr. Ashok Kumar Das sir. The most important effect of organon of volume 1 to 3 of fundamental homeopathy representing concept, method of practice, understanding scientific chronic disease.
Hello.
Hello.
हेलो डॉक्टर नायक जी, आवाज आ रही है क्या?
Yes, sir. I'm getting your voice.
ओके ओके ओके. गुड आफ्टरनून डॉक्टर दास साहब.
Yes. Good afternoon.
हाउ आर यू सर?
Yes, fine. How are you?
थैंक यू सर.
Thank
नो डाउट हम सभी विदित है कि डॉक्टर ए.के. दास जी बहुत ही रिनाउंड प्रोफेसर हैं और इंडिया एज वेल एज फॉरेन कंट्री में डॉक्टर दास साहब को सभी लोग जानते हैं और इनकी जो बुक है आई थिंक से हम सभी लोग उसी किताब से पढ़ करके आज लेक्चर, रीडर, प्रोफेसर और प्रिंसिपल बने हुए हैं. और आज का जो टॉपिक है आई थिंक से होम्योपैथी के लिए बहुत ही इम्पोर्टेंट है. बिना मियाजमेटिक अप्रोच के हम कोई भी ट्रीटमेंट तो करते हैं, लेकिन प्रॉपरली जो क्योरिंग पॉइंट ऑफ व्यू है, जब तक हम मियाजमेटिक अप्रोच से अगर ट्रीटमेंट नहीं करेंगे तो आई थिंक से हमें बहुत अच्छा बेटर रिजल्ट नहीं मिलेगा. तो जो सर का जो टॉपिक है मियाजमेटिक डायग्नोसिस एंड इन क्लिनिकल एप्लीकेशन, ये बहुत ही इम्पोर्टेंट टॉपिक है. हम चाहेंगे जो लोग भी हमारे छात्र जुड़े हुए हैं, आप अच्छे से डॉक्टर दास सर को सुनिए और उसका इम्प्लीमेंट अपने क्लिनिक जो है प्रैक्टिस में इसको अप्लाई करिए, जिससे कि हम एक अच्छा होम्योपैथ तो बनेंगे ही बनेंगे और होम्योपैथी का इससे प्रचार प्रसार भी होगा कि होम्योपैथी के द्वारा जो है हम ज़्यादा से ज़्यादा जनमानस को जो है अच्छा से अच्छा ट्रीटमेंट दे सकते हैं. बहुत बहुत धन्यवाद अशोक सर. जो है आप अच्छे से हमारे बच्चों को जो भी इनकी क्वेरी होगी इसको सॉर्ट आउट करने का प्रयास करिएगा. बहुत बहुत धन्यवाद सर आपको.
Thank you, sir. Thank you.
Vaishali.
Thank you so much, sir.
Vaishali, I would like to say something about. Then after Dr. B.P. Verma will tell about Dr. A.K. Das sir. So, sir, first of all, I would like to give huge thanks as you accepted our proposal second time, and I know very well that you are not only a good knowledgeable person, but you are a very humble personality, because I asked you that National Homeopathic Medical College students want to get some knowledge from your side, and you accepted our proposal. So, sir, thank you so much for that. And secondly, the topic is really very, very good, and I know very well that everybody wants to know about the miasm. And when I interacted many times, I have 25 years of experience. Still, I have lot of problems related to miasm. because Dr. Animan said that man can never be perfect. So, as our principal Professor Dr. D.K. Sonkar sir told me, and in front of us that your book is very popular, and we studied a lot about the Miasm in your book. So I hope that you will give some extra valuable information and knowledge to our students. So, sir, thank you so much for that.
Thank you.
We have HOD of material, HOD of Organ of Medicine, Dr. BP Verma is here. Sir,
Okay.
Professor Dr. D.K. Sonkar sir.
दास सर को गुड आफ्टरनून।
Good afternoon.
इस वेबिनार में उपस्थित सभी प्राचार्यगण, सभी सम्मानित शिक्षक बंधु तथा हमारे सभी छात्र एवं छात्राएं, अभी हमारी छात्रा डॉक्टर वैशाली ने खुद ही सर का परिचय दे दिया है। जो कुछ हमको बोलने के लिए कुछ बचा नहीं है सर। ही इज अ वेरी गुड साइंटिस्ट, राइटर, अ वेरी गुड टीचर and a very good speaker also. So many books he has written, like treatise on organ of medicine, volume 1, 2, 3, repertory, Honeyman's chronic diseases. सर किसी परिचय के मोहताज नहीं है। ऑल इंडिया में आपकी कीर्ति छाई हुई है। ये मेरा सौभाग्य है कि हम सर के वेबिनार को आज पहली बार वेबिनार के रूप में आज हम इसको सुनेंगे, और हम आशा है कि हम सभी शिक्षक बंधु, सभी प्राचार्यगण और सबसे ज्यादा जो हमारे छात्र एवं छात्राएं हैं वे इससे लाभान्वित होंगे। सर, ऑल द वेरी बेस्ट।
Thank you.
आज सर को अगेन सर कभी मौका मिला तो सर मैं आपसे रूबरू होऊंगा। आपके आशीर्वाद का आकांक्षी हूँ सर। और ऑल इंडिया में मैं जहाँ कहीं वाइवा लेने, जहाँ कहीं मैं मेडिकल कॉलेज का इंस्पेक्शन करने गया, मैं जरूर अपने बच्चों से एक सवाल पूछता हूँ। वहाँ पे बच्चे तो सारे अपने हैं एक टीचर के लिए कि योर नेम ऑफ योर बुक ऑर्गन ऑफ मेडिसिन इज, सीधे सीधे कुछ बोलते नहीं है, डॉक्टर ए के दास सर को बोलते हैं। तो मेरा कोई परिचय देने का कोई सवाल ही नहीं उठता। हु द हेल आई एम टू इंट्रोड्यूस डॉक्टर ए के दास सर। सर कुछ ऐसा मौका दीजिए कि हम लोग आपसे मुखातिब हों, आपसे रूबरू हों। ये टेलीफोनिक और ये मोबाइल से मजा नहीं आ रही है सर। तो कभी कुछ ऐसा करिए सर कि हम सब लोग एक मंच पे इकट्ठा हों। तो मेरी शुभकामनाएं सर हैं। और आपकी तारीफ करना सूरज को दिया दिखाने के बराबर है। इससे ज्यादा मैं सर समय नहीं लूंगा, बहुत वैल्यूएबल टाइम है। प्लीज एंजॉय दिस काइंड ऑफ क्लास वेबिनार सर। हेड्स अप सर, सल्यूट यू सर, नमस्कार।
Thank you. Thank you.
Especially
Thank you,
without
sir.
wasting sir's time and our time, you shall start today's topic, and that will be very interesting. Okay.
Okay,
Okay.
sir.
Okay.
Yes.
Okay.
Thank you, Dr. D.K. Sonkar, sir, and Amit Nayak, sir, and V.K. Verma, sir. Now I request Dr. Ashok Kumar, sir, to start the seminar.
Good afternoon to everybody. At the outset, I extend my heartfelt thanks to the principal of National Homeopathic Medical College, Lucknow, the different faculty members of different departments like organ of medicine, with a special reference to Dr. Amit Naik, who actually is the instrumental to arrange this program. The subject of the topic miasm is a very important in homeopathy, but still misunderstood. To be a successful homeopathic clinical practitioner, you need to have a clear-cut understanding of the concept of miasm so that you can apply it in clinical practice. In my lectures of 4 days, I would like to discuss the subject under 4 broad headings. Number 1, Miasm, the basics. Number 2, understanding miasm through their clinical manifestations. Number 3, application of this theoretical knowledge of miasm into clinical practice by miasmatic diagnosis in a patient. And at last, I would like to share my clinical experience. That means to study the concept of miasm through different case studies. Let us first start the miasm, the basics. The first one, how the concept of miasm has developed in homeopathy. After the discovery of Hahnemann of homeopathy and its practice for the last about 30 years, from 1719 to 82, Hahnemann observed that the acute diseases, when treated on the basis of the law of similia, simplex, and minimum, the acute diseases can be cured successfully. But as regards the outcome of treatment of non-venereal chronic diseases being treated on the basis of the present symptoms is not satisfactory. Even after following the law of similia, even after the best homeopathic treatment, the non-venereal chronic diseases always returned in a more or less valid form and with new symptoms, and reappeared annually with an increase of complaints. So, what was Hahnemann's observation? The acute diseases can be cured speedily and completely by homeopathic treatment. But he fails to cure chronic diseases when he prescribed on the basis of the present symptoms following the law of similia. That's why Hahnemann stated, their beginning was promising. There means the treatment of chronic diseases, beginning is promising, the continuation less favorable, and the outcome hopeless. That means he fails in spite of his best effort while prescribing on the basis of the present symptoms. Why? Why he failed to cure the chronic diseases? Several questions raised in his mind, out of which he mentioned 5 questions in his mind. Number 1, law of similia may not be applicable universally. Number 2, inadequate number of proved homeopathic medicine to cover the different types of human diseases. Number 3, some defect in the application of law of similia. Number 4, some defect in ascertaining the totality of symptoms. And the last, not the least, presence of some obstacles to cure overlooked. Now, I will discuss each point one by one. first one, the law of similia may not be applicable in all cases, that is universally. But as you know, that this law of similia is derived by Hahnemann on the basis of several observations and experiments through inductive and deductive mode of reasoning, and this law always followed by nature. As you know, nature is always applicable universally. The sun shines, it gives light to everyone. It is universal. So as the law of similia is a natural law of cure based on natural observations and experiments deduced from inductive and deductive logic, so Hahnemann concluded that no, law of similia is universally applicable. So this may not be the reason for the failure of cure of chronic diseases. The second point, inadequate number of proved homeopathic medicines. Initially, Hahnemann thought that is it due to the limited number of proved medicines, so that he can't able to cover the whole symptom totality of the different chronic diseases. But what was his observations? With the progress of time, many medicines are proved, included in our homeopathic materia medica. But in spite of those newly developed medicines, proved medicines, the outcome of chronic diseases remain the same. So, the inadequate number of proved medicines, proved homeopathic medicines, should not be the reason for failure of curing chronic diseases. The third one, is there any defect in the application of the law of similia? Please keep in mind, at the initial stage, Hahnemann prescribed medicines in chronic cases and acute diseases definitely on the basis of the present complaints. Medicine was given on the basis of the present complaints. He thought there may be some defect in the application of the law of similia. The next one, some defects in ascertaining the totality of the symptoms. That means whatever we are thinking the totality of the case is not the actual totality. That is very important. The disease returns even after giving homeopathic medicines in varied form. The very language given by Hahnemann, just I read out, this return of symptoms should not be considered as separate disease. All the fragments of the disease appearing in so many various forms are the varied expression of continuous, progressive disease process which constitutes the disease itself. So, the law of cure was not at fault, but the defects was ascertaining the totality of the symptoms on a broader basis, consisting not only the present symptoms on the broader basis, consisting not only the present symptoms, but the past symptoms as well. As I told you that initially medicine was prescribed on the basis of the present symptoms, but after that there is again recurrence of symptoms. So he concluded that perhaps we are missing the totality of the symptoms of the case. That means whatever the present symptoms are presenting is not the true totality of the case. Please keep in mind that the present symptoms are not the true totality of the symptoms. That's why we fail to cure. Where I can start. Okay. Hello. Everyone can listen. Hello. Yes, sir. So what I last time I have discussed that Hahnemann failed to cure chronic diseases when prescribed on the basis of the present symptoms. That leads to study retrospectively different cases which he failed to cure. Hello? Okay, okay. So, Hahnemann retrospectively studies the different chronic cases which he failed to cure. Now, what was his retrospective study leads to observe certain facts. What was those facts? That there were a group of patients having the history of suppression of the skin disease, another group of patients having the history of gonorrhea, and another group of patients having the history of suppression of syphilis. So, the retrospective study of different cases which Hahnemann failed to cure leads to observe that there are certain cases where there is history of suppression of the eruption of itch, another group of patients having the history of suppression of gonorrhea, and another group having the history of suppression of syphilis. Now, this suppression of eruption of itch or disappearance from the skin through other means is followed by a train of symptoms. Hahnemann observed that there was a group of patients having the history of suppression of the eruption of itch, and after the suppression of the itch, there are a development of different group of symptoms. Similarly, he observed a group of patients having the history of syphilis or gonorrhea leads to the development of another group of symptoms. So a group of patients having the history of suppression of skin disease, another group of patients having the history of suppression of gonorrhea, or another patients having the history of suppression of syphilis. And Hahnemann come to the conclusion that those suppression of skin disease or syphilis or gonorrhea produce such a state in the body that acts as obstacles to cure. So please keep in mind that history of suppression of the skin disease, history of suppression of gonorrhea, history of suppression of syphilis, that leads to the development of certain state within the body, which leads to the development of different group of symptoms. The group of symptoms related to skin disease suppression, element called the SORA. The group of symptoms which developed after suppression of gonorrhea leads to the development of the psychotic miasm, and those group of patients having the history of suppression of syphilis, they lead to the development of syphilitic miasm. So suppression of skin disease, suppression of gonorrhea, suppression of syphilis, that leads to the development of three types of miasm: the SORA, syphilis, and psychosis. Not only that, that whatever symptoms he has observed at present time, it's not the true totality of the case. The different symptoms developed after the suppression of the skin disease, the different symptoms developed after the suppression of psychosis, gonorrhea, or the different symptoms developed after the suppression of syphilis. All the different valid type of symptoms developed after such suppression to the present symptoms ought to be considered in prescription. The present symptoms are the result of a whole disease process which has started after the suppression. Please keep in mind, try to understand that one, that the present symptoms are the end result of a disease process which has started after the suppression of skin disease, after the suppression of syphilis, after the suppression of psychosis, and the different symptoms which have developed time to time ought to be considered as the true totality of the case, and you have to consider all those symptoms in finding out your medicine. So the suppression of skin disease, suppression of gonorrhea, suppression of syphilis produces a miasmatic state in the body which are to be considered during our homeopathic prescription to cure. So this is the development of SORA theory, and SORA, syphilis, and psychosis. If we come to the specifically SORA, the sum total of the symptoms during the skin eruption and the symptoms developed after the suppression grouped into a gel named SORA. This SORA acts as the obstacles in the way of complete cure. That I have told you in relation to the other two miasms. Now coming to the literal meaning of the word miasm. The word miasm is derived from the Greek word miasma. The literal meaning during Hahnemann's time was: number one, the polluting exhalations or discharges, malarial poisons, morbific emanations or discharges from putrescent organic matter, animal or vegetable, effluvia arising from the bodies of those affected by certain diseases, some of which were regarded as infectious or non-infectious. So these are the literal meaning, certain polluting agents. But what about Hahnemann? According to Hahnemann, miasm is a combination of signs and symptoms with a morbid process. So miasm, according to Hahnemann, is a chronic syndrome. Syndrome means a combination of signs and symptoms associated with a morbid process. So, by definition, we can say this is the dynamic disease producing power which pollutes the human organism and becomes the producer of every possible disease condition. So, miasm is a dynamic disease producing power. Now, what may be the different types of miasm? Hahnemann classified miasm mainly into two broad classification: acute miasm and chronic miasm. The acute miasm may again be of two types: the recurring type of acute miasm, like cholera, plague. The recurring type means those type of acute diseases which recurs in the lifetime of the patient, as for example cholera, plague. But there are another type of acute miasm, non-recurring acute miasm or fixed miasm, like smallpox, whooping cough, etc., where the acute disease only occurs once in a lifetime. So, non-recurring type of acute miasm is known as fixed miasm. The second one, the chronic miasm, as I told you, may be of three types: sora, syphilis, and psychosis. Please keep in mind, whatever I will discuss here, this is the classical concept of Hahnemann and homeopathy. There are certain other chronic miasms, as advocated by Dr. Allen, J.H. Allen, tubercular miasm, but there are a lot of controversy also. I will discuss later on. Initially, I want to discuss the classical concept of miasm. That's why I purposefully avoided that particular miasm. So, from Hahnemannian classification, sora, syphilis, and psychosis. Apart from these two broad classification of miasm, mentioned two other types of miasm, that is half acute miasm, that is the miasm of hydrophobia, and accessory miasm of cowpox vaccine. So he also added half acute miasm and accessory miasm of cowpox vaccine. But in my lecture, I would like to concentrate only on chronic miasm, that is sora, syphilis, and psychosis. Now, the chronic miasm, according to Hahnemann, is the fundamental cause of chronic diseases. Please keep in mind. They produce true chronic diseases and predispose human being to acute diseases. If you recollect the classification of chronic diseases according to Hahnemann, Hahnemann classified the chronic diseases into three broad classifications. One, the true natural chronic diseases. Number two, artificial chronic diseases. Number three, pseudochronic. Now, the fundamental cause of true natural chronic diseases are the miasms. And not only that, this miasms predispose human being to the acute diseases. Acute diseases is nothing but the explosion of latent soda. So this soda predisposes human being to acute diseases. So please keep in mind, according to homeopathy, the cause of chronic diseases are the chronic miasms. Another important thing, this chronic miasm is ineradicable by the vital force. As you know, in case of acute disease is a self-limiting disease, started suddenly, have a definite time period, and ends either death or recovery. So this is acute disease produced due to some exciting cause. But in chronic disease, it starts slowly and insidiously. There is no fixed duration of suffering. It goes on increasing with the progress of the life of the patient and ends death. Even it is transmitted to the next generations. In spite of the best mental and physical regimen and diet, the chronic diseases cannot be cured. They can only be cured by proper anti-miasmatic medicinal treatment. So you must have a clear-cut idea about the acute disease and chronic disease. And that can only be known through the manifestations, through the history of the patient. And this chronic disease cannot be cured by the patient's vital force, in spite of best diet, lifestyle, whatever may be. Please keep in mind, here is a very interesting concept in homeopathy I would like to discuss with you, share with you, that according to Hahnemann, the chronic miasms are the fundamental cause of the disease. But to produce a disease, they need certain accessory circumstances. Please listen it minutely. In section aphorism 5, 7, 94, 208, footnote 81, Hahnemann mentioned the idea of accessory circumstances. In addition to these miasms, some circumstantial factors also may tend to produce, to maintain, or to increase the disease, especially of chronic one. These additional contributing factors are known as accessory circumstances. Please try to understand that miasms, okay, but miasms, to produce a disease, it needs certain accessory circumstantial factors, which, according to Hahnemann, is known as accessory circumstances. So, it is the interaction between miasm and accessory circumstances which leads to the development of different chronic diseases. What are those factors related to accessory circumstances? Number one, the ascertainable physical constitution of the patient, the moral and intellectual character, occupation, mode of living and habits, social and domestic relations, age, sexual functions, etc. I think it needs a very good discussion on these aspects, because we all say miasm, miasm, and miasm, but what's the role of accessory circumstances? That is also to be known. So I will try to give certain emphasis on these few points. Number one, the ascertainable physical constitution of the patient. What is constitution? Constitution, the physical, mental makeup of individual. It is very short definition, I can say. This is the physical and mental makeup of an individual. Now, apart from this physical constitution, so constitution has two components. One is the physical component, another is the mental component. In fact, there is another component, that is biological component, but that is not, it is related to that. That I will only say that constitution is nothing but the physical and mental constitution, makeup of an individual. And this physical constitution is also related to the miasm. Someone is very fatty and flabby, someone is very lean and thin. So these are also reflecting the accessory circumstances which leads to the development of the disease. To produce a disease, the moral and intellectual character. Yes, the moral and intellectual character of the patient has some contribution in the development of the disease. Next, the occupation. There are certain factors in the occupation which, in addition to the miasm, interacts to produce certain chronic diseases. So, if you see the different occupational related diseases, that is also comes here. The mode of living and habits. At present, you know, lifestyle disorders, how the lifestyle of the patient contributes to the development of the different diseases. Hahnemann also says the habits like smoking, habits like alcohol, habits like drug abuse, all are related to the development of different diseases. Next, the social and domestic relations, the relations in the family, the relations in the society, the interaction with in the occupation, all social domestic relations, that also related to the development of different diseases. Age, very important one. Some diseases are more prevalent in certain diseases, in case of children, in case of old ages, middle. So age has certain contributing factors in the development of different diseases. Next, sexual functions. As you know, there are different diseases which are related to the sexual activity of an individual, and etc. Yes, that means apart from those, there may be so many other factors like environment. Please keep in mind, environment is an important factor in the contribution of the different diseases. So if you think of in that way, if you study Hahnemann, organon and miasm, you will see, according to Hahnemann, the chronic diseases are produced by miasms, fundamental cause, but that can only produce manifested chronic disease whenever it interacts with different accessory circumstantial factors. So, the chronic diseases, concept of chronic diseases, the miasm, and interaction with accessory circumstances. Please, I need to discuss another aspect. You see, Hahnemann told this concept about more than 200 years back. But if you see the present concept of chronic disease in modern science, and then you can also correlate with that. So, for the time being, I will give certain emphasis on the what is concept of chronic diseases in modern science. At present, if you go through the recent literatures of different books, the cause of different chronic diseases is gene environmental interaction. Very, very important. Gene environmental interaction is the cause of different chronic diseases. The rapid development in molecular biology in recent years have led to dramatic increase our understanding of the genetic influence or on many human diseases. So how gene is being related with the development of different diseases, we can understand through the present concept of molecular biology. These complex diseases tend to aggregate in families, but their familial distributions are inconsistent with simple Mendelian modes of inheritance, autosomal or X-linked, dominant or recessive. I'll give certain very few basics of genetics. Diseases, there are certain diseases which are related to the genetic disease, like hemophilia. So hemophilia is a genetic disease. Like think of different very common one, thalassemia. Now this thalassemia is also a genetic disease, but they are linked with certain XY chromosome. That is, certain disease is only prevalent in male or in female. But apart from that, there is another concept is coming, that is genetic susceptibility. According to the modern science, the persons have some genetic basis of susceptibility, like the genetic susceptibility to cancer, genetic susceptibility to diabetes mellitus, genetic susceptibility to the development of ischemic heart diseases. Very common is cancer. Cancer is now considered as a genetic disease. But you may have a gene, but that gene will not express the disease until and unless you are exposed to the environment. And for example, breast cancer gene. Those females having the gene of the breast cancer but not exposed to certain environmental factors, they will not be the sufferer of breast cancer. So, the gene produces susceptibility in individual, but exposure to different environmental lifestyle factors which leads to the development of the disease. Another example, type 2 diabetes mellitus. In Southeast Asian region, the type 2 diabetes mellitus is now become the most important health hazards because the South Asian people has genetic susceptibility towards diabetes mellitus. Many of us has this genetic susceptibility, but only genetic susceptibility will not lead to the development of disease. The food habits, the obesity, different environmental factors, when interacts with this person having the genetic susceptibility, then only you can produce diabetes mellitus, cancer, other different ischemic heart diseases. So if you think now the accessory circumstances, if you see everything, they are mainly in relation to the environment and individual. So accessory circumstances, they can be correlated with the environmental factors of the modern science, and the miasm, which is inherited portion, inherited trait, that can be related with gene. So what Hahnemann told 200 years back, that the miasm and the accessory circumstances, interaction between the two is the cause of the disease, is the cause of the chronic disease. But at present, the modern science says the gene and environmental interaction is the cause of the disease. So in these aspects, we can correlate Hahnemann concept with the concept of modern science. So if you have any confusion in this regard, we can discuss at the end. Now, I want to restrict my discussion into the development of SORA, the development of psychosis, and development of syphilis. Now you see, all the three miasms have different stages. The manifestations of different miasms are different. The manifestation of the same miasm differs according to the stage. So we must know the different stages of miasm. That is very, very important. So common stages of development of miasms. The first one, when the first infection occurs. Now, after the entry of the infection in our body, there is a stage of internal development. And after the completion of the internal development, there is external expression by which we can know the miasmatic state of the person. So, the entry of the miasm, next internal development, followed by external manifestations. Please keep in mind, this is the stages. The first entry of the infection of the miasm, internal development, and external manifestations. Now these external manifestations may be of three types: the primary manifestations, the latent state, the secondary manifestation. This concept is equally applicable in case of SORA, syphilis, and psychosis. That means you need to know the primary manifestation of the SORA, symptoms of latent SORA, then the secondary manifestation of SORA. Similarly, you need to know the primary manifestation of psychosis and the secondary manifestation of psychosis. The latent state of psychosis and syphilis were not described by Hahnemann, but later on Dr. J.H. Allen added the latent state of psychosis and syphilis. Similarly, you need to know the primary manifestation of syphilis, the latent state symptoms of syphilis, and the secondary manifestations of syphilis. To summarize the whole thing, that if you want to understand miasm through its manifestations, you have to know the primary manifestations, either SORA, syphilis, and psychosis. You need to know the symptoms of latent state of SORA, syphilis, and psychosis. And at last, you need to know the secondary manifestations of SORA, syphilis, and psychosis. Whenever a patient may comes to you, it may come with primary manifestations or the symptoms of latent state or the symptoms of secondary manifestations. So, for the diagnosis of each this state, we must have a knowledge about those manifestations of different miasms. I want to discuss the first SORA. As I already discussed, there is a mode of infection, internal development, manifestation of the external ailments, the primary, latent, and secondary. Already I have told you this part. Now, how first? What is the mode of infection? How the soric miasm enters in our body? SORA is the most infectious of all chronic miasms. The fluid in each vesicle contains the soric miasm. Please keep in mind. Each vesicle, within that there are certain liquids, fluid, it contains soric miasms. Whenever that fluid comes in contact with skin, especially with tender children, the miasm gets an entry into the body. Again, I repeat, each vesicles containing the fluid contains the soric miasm. Whenever there is scratching of this particular each vesicles, the fluid comes out, and whenever that fluid come in contact with anyone's skin, the miasm gets an entry into the body. The disposition of being affected with the miasm of the yeast is found almost everyone and under all circumstances. That means all human being has the disposition to be affected by such soric miasms. So, soric miasm that spreads through touch. Hahnemann discussed the different methods of communication of the soric infection in his book of chronic diseases. From physician to the patient. The physician, while examining a patient, he can communicate the soric miasm to the patient. So, very common. As a physician, we are examining the patient, we are touching, we are examining the pulse, we are physically examining the patient, and unconsciously we can transmit that soric miasm to our patients. Another one, from mother or midwife to the baby. Whenever a baby is born, while passing through the organs of the mother, they get infected. They may be infected through the hands of midwife. So, mother during delivery, in the initial, the midwife can transmit the soric miasm by touch. The suckling baby can get soric infection through the nuts. All are nothing but the transmission of the soric miasm through touch. There are innumerable modes by which soric miasm may be transmitted in the children, but always through touch, through the soric miasm containing within the fluid of the each vesicles, that is soric each vesicles. Now, this is the first part. It comes in contact with the skin and that it causes internal development. As soon as the miasma of each touches the skin, it remains no more local. Henceforth, all washings and cleansings of the spot avail nothing. Instantly after touch, it enters into the body. If you wash it afterwards or clean it, you cannot avoid sora. Nothing is seen in the skin during the first few days. It remains unchanged according to the appearance healthy. There is no eruption or itching to be noticed on the body during these days, not even on the spot infected. The nerve, which first affected by the miasma, has communicated it in an invisible or dynamic manner to the nerves of the rest of the body. Not until a certain number of days have lapsed, when the miasmatic disease has received its complete internal development in the whole body, not until then, from the fullness of internal suffering, the local symptoms break forth. That means after the entry of the soric miasm, there is a time for internal development. Okay? And this time it pollutes the whole organism. There is a stage of internal development, and after completion of the internal development, there are external manifestations, and first the primary manifestations, that is primary manifestation of sora. In short, just to remind that the sodic miasm comes from the fluid from the each vesicles through touch to the individual. The miasms then enter into the body, completes its internal development. After completion of the internal development, there is external manifestations. The first manifestation is the primary manifestation. So if you think of the whole stages, entry of the miasm, internal development of the miasm within the individual, followed by external manifestations, and initially as primary manifestations. So what about the primary manifestations of sora? After the completion of the internal development of the sora, the diseased vital force tries to alleviate and to soothe the internal malady through the establishment of the suitable local symptoms of skin, the each vesicles. Very nicely Hahnemann explained that the vital force always tries to keep the internal vital organs free from disease. That's why vital force transmitted the disease, transferred the disease to the external skin, less vital organs of our body. So, in order to keep the internal important body organs free from disease, the vital force throws, transfer the internal disease to the external parts, that is on the skin, in the form of each vesicles. Usually it takes 6, 7 or 10, perhaps even 14 days That means it's 6 to 14 days from the moment of infection before the transformation of the entire internal organism into sora has been effected. Then, after a slight or more severe chill in the evening and a general heat, followed by perspiration the following night, a little fever, which many persons had ascribed to a cold and therefore disregarded, the vesicles appeared at first in the region of the spot parts of each will appear. Please keep in mind the each vesicle will appear in the part where the particular miasm gets an entry. At first, they are fine, as if from miliary fever, but afterwards, enlarging on the skin, they appear at first in the region of the spot first infected. So, after completion of the internal development, the each vesicle appears to that part where the miasm gets its first entry with slight chill and fever. So this is the primary manifestation of sora. This is associated with voluptuously tickling itching. What is voluptuous? Itching of the skin produces a pleasure like that of sexual interaction. That is voluptuous. It gives sexual pleasure by scratching, which compels the patient irresistibly to rub and scratch the vesicles of each. If a person restrains himself forcibly from the rubbing or scratching, a shudder passes over the skin of the whole body. This rubbing and scratching satisfied somewhat for a few moments, but immediately follows by long continued burning of the parts affected. That means severe itching, severe voluptuous itching, followed by scratching, and then followed by burning is the characteristic feature of primary manifestation of sora. This itching is most frequent and more unbearable in the late evening and before midnight. So this itching is much more at late evening and before midnight. So this is the primary manifestations, each vesicles with severe voluptuous itching, scratching followed by burning, and that itching aggravates late evening and before midnight. In the first hours, the vesicles of each contains watery fluid, but this quickly changes in the past. First maybe vesicular, then becomes pustular, which fills the tip of the vesicles. Such violent rubbing breaks up the vesicles, and fluid pressed out furnishes abundant material for infecting the surroundings of the patient and also other persons not yet infected. Yes, by whenever you scratch, the fluid comes out, and that fluid, which contains soric miasm, also touches the other parts of the patient's body, and it may also transfer or transmit the disease to the surrounding people. The extremities defilled even to a impossible degree with these limbs, so the cloths of the utensils of all kind when touched propagate the disease. This is the propagation, that whenever this soric fluid comes in contact with cloths, utensils, any time, what is any part come in contact, that may propagate the soric miasm to each of us. And that's why soric miasm is universal. So long as this eruption, but please, very important one, so long as this eruption remains in the normal form, the internal sora with its secondary elements cannot break forth, but must remain covered, slumbering, and latent. The eruptional symptoms acts as a substitute for the internal malady. and keeps the patient free from secondary ailments. I told you earlier, the vital force tries to throw the internal disease to the skin as if they are the substitute of the internal disease. So long the skin disease remains on the skin, or skin, each vesicle remains on the skin, there will be no secondary ailments. And in this state, disease is most easily cured through a specific remedies internally administered. Please keep in mind, here Hahnemann told that the a miasm in its primary state can be cured easily. Please keep in mind, it may be soda, it may be psychosis, it may be syphilis. So far I have discussed, if you think of in that way, what I told you, the sodic miasm gets an entry into our body through touch, internal development, followed by external manifestations of the primary manifestations, and so long the primary manifestations remain on the skin, the internal disease will not produce the secondary manifestations. But if the disease is allowed to advance in its peculiar course without the use of any internal curative remedy or an external application to drive away the eruption, the whole disease within rapidly increases. Very nicely described that if it is not being treated by externally, without any or not treated by any curative medicine, the skin disease go on increasing day by day. As I told you, that chronic disease is a lifelong process. As the time passes, the internal miasmatic state also increased, and the vital force, in order to get rid of the internal disease, is go on increasing the external manifestations. So, with the progress of the time, the chronic diseases internally increases, and at the same time there is increase of external skin manifestations. This increase of the internal malady makes necessary a corresponding increase of the skin symptoms. The each eruption therefore has to be sprayed, must finally cover the whole surface of the body in order to be able to soothe and to keep the increased internal malady latent. Yet, even at this stage of the disease, the patient still appears healthy in every other aspects. All the symptoms of the internal sora, now so much increased, still remain covered through the skin symptoms, augmented in the same proportion. That means at this stage, disease is only located on the skin. So the sora, whenever they are on the skin, it can be easily cured by some specific medicine in its primary stage. Now, switch over to another state. I told you the latent state of sora. When the primary manifestation of sora are treated by local application, either artificial or natural, then the local cutaneous symptoms disappeared, suppressed, but the disease is driven inwards and may remain dormant in the best cases and under most favorable external circumstances. This state is known as the latent state of sora. Yes, please try to understand this particular state. There is primary manifestation of sora on the skin. Okay? But whenever the life situation, the patient remains in a favorable external circumstances, in spite of treatment by external means, the disease remains in a latent state. If you think of the stages, number one, external manifestation of soda on the skin, treated by some external application, locally treated by some external application. It may be artificial or natural. How? Artificial means the patient, individual, is being treated by so many external ointments. So this is the artificial way of treatment of primary manifestation of soda. But there are certain natural means. You know, there are certain water where the water contains the different chemical substances, minerals, and the patient, after taking bath in those areas, suddenly the skin disease disappeared. Different way water sources contains certain minerals which can also suppress the skin eruptions. So whenever that psoriatic manifestations is being suppressed, either by artificial means by the physician or the patient himself through some local application or by some natural means, the soda remained in a latent state so long his lifestyle is normal, his external circumstances are favorable, they do not produce any disease which can be diagnosed. So this state is known as the latent state of soda. Please keep in mind, during the latent state of soda, you will not be able to diagnose any disease. The person who has the soda slumbering within him shows much semblance of health. But when the health have been very much weakened by some exciting cause, then the soda, which had hitherto slumbered, awakens and breaks out as the severe, nameless, sorry chronic diseases. They are the secondary manifestation of soda. That means primary manifestation of soda treated by some external means, either artificial or natural, disappearance of the primary manifestation from the skin. But as the life situation is healthy, as the external circumstances are favorable, the soda remained in a dormant state. That is the latent state of soda. Whenever the same person is being exposed to some exciting cause, to some unfavorable life situation, the latent soda manifests to produce nameless so many different types of psoriatic chronic diseases, and they are the secondary manifestation of soda. Now, what are the different favorable unfavorable conditions of life as exciting cause? Please, how Hahnemann described very nicely. You see, what may be the different unfavorable conditions of life which may act as the exciting cause? A prevalent epidemic disease. I will give you a very good example. Perhaps you know, we have just tide over COVID-19 pandemic. And it has been found in your clinical practice that after suffering from COVID, so many different chronic diseases have cropped up. As you know, that they are the after effects of COVID-19. According to Hahnemann, that such type of epidemic disease also can produce psoriatic chronic diseases in persons whose psora are in a dormant conditions. We have regularly examining many patients suffers from bronchial asthma, suffers from heart attack, suffers from so many diabetes mellitus after recovery from COVID-19. How nicely Hahnemann gives the different examples 200 years back. Still, we can apply this concept at the present day that this a prevalent epidemic disease can produce the psoriatic chronic diseases or other chronic diseases. Next, an infectious acute disease. We have seen after whooping cough, the patient develops tuberculosis. After whooping cough, the patient develops pneumonia or so many other diseases. So, infectious acute disease, an external severe lesion like a fall, a wound, a considerable burn. Yes, after fall, is which make acts as a internal, which make acts as exciting cause. Not only that, Hahnemann told that this exciting cause, along with allopathic treatment of that allopathic acute disease, also ruins the health of the patient, so that there is development of chronic diseases. Hot labor, continuous mental and physical work you are doing, then that acts as exciting cause to produce different chronic diseases. Confinement due to the disease with allopathic treatment. Confinement due to the sedentary occupation in a gloomy closed room. You say you are working all through the day, you see at present work from home, sedentary habits within a closed room may lead to the development of different types of disease. We have seen at present many of the workers after COVID-19 working from home, sedentary habits leads to obesity, so many different types of diseases they are now developing. Grief due to loss of beloved ones. Yes, it is very common one that after the death of husband, after the death of the son, so many different types of new different diseases has developed. Daily vexation and annoyance which embitter life. Vexation, continuous vexation and annoyance that leads to different chronic diseases. Deterioration of the food or entire want of what is necessary and indispensable. Yes, as you know, to maintain healthy life, we need vitamins, minerals, adequate amount of protein, carbohydrate, fat. So if we do not get adequate amount of nutrients, it may be protein, carbohydrate, fat, or minerals that may lead to different chronic diseases. That means deficiency, both quality and quantity. Next, exposure to inferior quality food, beating down man's courage and strength. Yes, I told you can say both the quality and the quantity of the food. That is also important. To summarize, you see here that Hahnemann given so many examples of unfavorable life situations which may strike, which may excite the psoriatic miasms, which may excite the psoriatic miasms, latent psora, to produce psoriatic chronic disease. Please, this part is very important. If we correlate with the present concept, we can correlate with the present knowledge of disease production, disease development as conceived by the allopathic modern science. So, this particular aspects, which is very important to summarize. So, if you can summarize the development of psora, primary manifestation of psora, suppressed artificially or naturally, the local symptoms disappear, but the disease is driven inwards and may remain in a dormant state, that is the latent psora, exposed to some exciting cause, manifest psoriatic chronic diseases, that is the secondary manifestation of psora. Please keep in mind, this is in summary the development of psora. In this connection, the different favorable condition, you see, not only the environmental factors, but the psychological factors can also lead to the development of different psoriatic chronic diseases. In this regard, I must share the new concept in the modern science, that is psychoneuroimmunology. A modern concept is coming, that how your immune system is related to the mental status. I can refer certain research works of Harvard University where they have measured the different immune status of the individual after the death of husband, before examination, before interview. They have studied the different uh, immunological parameters, and they have seen that there is depressed immunological status in those unfavorable conditions of life. What I want to emphasize, that what Hahnemann told 200 years back, now we can correlate that concept with the present modern science for better understanding to treatment, and also to convince our students that yes, what Hahnemann told 200 years back or more than 200 years back is still relevant and can be explained in the light of the modern science. So time is over. I think I have just discussed, able to discuss the development of soda. So please, in summary, I have already told you, and also I have already correlated with the concept of gene environmental interaction, and at last psychoneuroimmunology, how the mind is related to the immunological status, and what Hahnemann told 200 years back is still relevant in understanding human diseases. So uh, now the time is over. Is there any question? We can discuss the question. Hello,
Thank you.
any question? Hello, hello,
Hello.
hello.
Thank you so much, sir, for such a nice session. And I request everyone, if you have any questions, so, that
So far I have discussed. Is there any question?
if anyone have any questions, please you can ask.
So no question. Hello, hello.
Hello, sir.
Yes, I think no question there. We can understand.
Yes, sir. यहाँ पे अभी कोई भी question है.
So everyone can listen. Is there any problem in listening afterwards? No.
No, sir. Everyone can listen this.
Yes, yes. Okay. So may I take the leave now?
Okay. Thank you so much, sir,
Thank you.
for such a
Thank
nice
you.
session.
Thank you. Thank you. Thank you all.